Good morning. I'm Amy Smellers, Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series session. We are thrilled to be continuing this series, which has hosted nearly a dozen interviews with healthcare leaders on the most important topics facing our Commonwealth patients and caregivers. A few logistics before we start. We will be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have any questions, please place them into the chat feature, and we will do our best to get them addressed during our time together today. Following the webinar, we will be sending out the recording. I want to take a moment to thank MHA's 2025 annual sponsors, as well as our strategic partners, for underwriting all of MHA's education programs. It's now my pleasure to hand it over to Steve Walsh, President and CEO of MHA.
Thank you, Amy. And to everyone joining us today, welcome back to our Executive Insight series, where we get to spend a morning cup of coffee getting to know the brightest minds in local healthcare. Since our last episode in the spring, the national healthcare landscape has changed dramatically, but our mission here in Massachusetts remains unchanged, and that is to provide accessible, affordable, world-class care for everyone who needs it. But we know it will take hard work and collaboration in the months and years ahead to make it happen. It will also take strong leadership and patient advocacy, and no one knows that better than today's guest. Amy Rosenthal is the Executive Director of Healthcare for All, an organization that has touched countless lives as it connects people with the healthcare services and resources they need. Amy has led Healthcare for All since 2017. During that time, the organization has doubled in size and played a major role in every major healthcare development our Commonwealth has seen, from leading the charge on COVID vaccines and prevention in our communities, to helping maintain coverage through the massive redetermination process, to advocating for important reforms that meet the needs of today's patients. And most importantly, they are an around-the-clock lifeline for anyone facing an issue with their healthcare needs. Healthcare for All is so often their beacon when they have nowhere else to turn. Previously, Amy served as the Director of External Affairs and Campaigns for Community Catalyst, where she co-led the organization's campaign to pass the Affordable Care Act. She has also held roles in the Massachusetts State House, at large academic hospitals, and at the Barbara Lee Family Foundation, where she served as Executive Director. Amy, thanks so much for joining us, and we're looking forward to diving into our conversation this morning.
Morning, Steve. Good morning, everyone.
And to kick things off, let's just go back to the beginning. You have had a career in public service that led you into healthcare. First, what drew you into public service?
Well, I grew up in the family of healthcare providers, and so healthcare was always a natural place for me to be. But even coming out of college, in my first job, I worked at what was at the time known as Children's Memorial Medical Center in Chicago. I think it's got a new name now. But I worked for a physician by the name of Kathy Christoffel, who really looked at healthcare and advocacy together and thought about issues from a public health lens. And I think that that was really instrumental for me to think about how to serve people in the healthcare space and really think about ways of helping them that were more than just providing medical care. And then probably maybe some of the folks here on the call, and I know Steve, you certainly knew Rob Rastuccia, who was the first Executive Director of Healthcare for All, and then later the founder and Executive Director of Community Catalyst, who was my mentor for many years. And one of the things I loved about Rob is he spent his whole career doing public service and public advocacy, and he had a theory that as a consumer health advocate, it was our responsibility to work with everyone who we possibly could in a collaborative way and recognize that sometimes we would be fighting with people and sometimes we would be working together side by side with people, and that it was important to maintain those relationships over time in order to do as much as you could for patients. So those are definitely some of the people that helped along the way.
Yeah, so you're somewhat surrounded by providers and docs too, but you ended up choosing the side of patients. I mean, was that a different choice? Did the family say, "What are you doing, Amy?"
Well, when I passed out one time when I was touring the burn unit at one of the hospitals, I decided the medical career was providing direct patient care was not going to be the avenue for me. But our dinner table conversations are filled with talk about patient care and advocacy, and it all intertwines.
That's great. It sounds like a fun table to be at. And you mentioned Rob, just a wonderful, gentle person, human being, contributor to our
It
community.
really was.
And obviously, one of your chief mentors, heard you talk about him a lot, but other mentors along the way. I mean, you worked for Barbara Lee, who has helped
Yeah,
uplift gender equality in politics and supported
amazing.
countless women candidates across the country. Was there any lessons you picked up from her or any other mentors that helped you achieve your goals?
Totally. I mean, Barbara Lee was amazing. It was my, my career has kind of spanned working in directly in hospitals in advocacy, and I did a fair amount in politics. And getting to run Barbara's foundation was really an incredible opportunity. Her mission was to try to have women take more prominence in executive roles like governor and ultimately president. And while her foundation recently wound down last year, that goal still remains for her and her work, but it was really interesting for me to really think about how gender plays an important role and can still be a challenge even in this day and age for women in executive leadership. And I'm glad that we're seeing so many women in the healthcare space in those executive roles. And I think how that plays out in politics will just continue to evolve. But Barbara really taught me about how to be a fierce advocate over many, many years for something that she cared so much about. And sometimes in healthcare policy work, you can feel a little burned out. And so I think having her persistence over so many years and continuing that even into her retirement, I think has always been a great model for me.
Yeah, if your dinner table was healthcare, mine was politics, and having a mom that was an elected official, Barbara's name was talked about more than on one occasion in our household for the
Yeah,
important work that she did to uplift a whole number of people across the country. But let's get to what you're doing now.
yeah.
Incredible work. You've been leading healthcare for all for a decade. In that time, what are some of the biggest shifts you've noticed when it comes to our patients and what they need?
Yeah. Well, it's interesting. When I got to Healthcare for All, we started a strategic planning process because we were in need of that. I think we were really fortunate here in Massachusetts that we lead the country in coverage and hope that we continue to do that for many years. And Healthcare for All had been focused for so many years on coverage expansion and working with you, Steve, when you were in the legislature, and working with so many other people on both Chapter 58 and Chapter 224, the two big health reform efforts of many years ago. And I think what we realized is that patients' needs were still, it's always going to be important for them to have coverage, but then we need to make sure that they can afford their coverage, that their care is accessible, and really always thinking about equity. And so those are the three areas that we've really dug into recently. So when we see statistics that 40% of people in Massachusetts have trouble affording their health care, and we know that this is particularly true for Hispanic and Latinx communities, this is really concerning. And so affordability is definitely something that we work, and we hear on it about on our helpline all the time, people calling really concerned about being able to afford their coverage. And then for all of you who work in hospitals, you certainly know about some of the accessibility issues as well, people waiting very long periods of time in order to see a primary care doctor, get the care that they need. And again, as I said, everything we do has an equity lens to it. So every bill that Healthcare for All champions in the legislature, we always, always work to make sure there's a health equity component to it. And some of the campaigns that we've run most recently, the big mass health redetermination campaign, I mean, we ran that campaign in 9 languages. And so we're always thinking about how we can reach the people that need to be reached, and do so in a way that's going to meet the needs of what they're living with every day.
Yeah, when you do a strategic plan, I imagine you have been in the middle of reacting to some of the biggest crises of our day, whether it be COVID or the steward challenges, or now as we look at some of the potential Medicaid and coverage changes. How do you balance kind of what the patient needs are you're working on versus reacting to the state of the world around us and what's changing rapidly.
Yeah, it is really hard. I mean, I think we set some goals, but we recognize that we need to be flexible with them. And so we go through a really extensive process when we're identifying our policy priorities for every 2 years. And I think what I found is, yes, did we anticipate the Steward hospitals were going to close down? No. But was the result of that an issue around accessibility and an issue around affordability and an issue of equity? Yes. And so I think a lot of because we spend so much time listening to the community, pulling themes from our helpline, running focus groups with community partners in order to identify our priorities, we find that even though there are these moments that are really significant, like a global pandemic that we need to pivot to, kind of our core underlying goals, stay somewhat consistent. And so while it is a balancing act and while we have to react, and it's interesting, I don't think people think of an advocacy organization as having to be entrepreneurial, but I think that that's something that I've always learned over the years, is that we need to find those moments in time where we can step in a really constructive way and be a good partner to the state, to our stakeholder partners, and most of all to the community. And I think it's that balance. There's no playbook, but I think some of it's like going off your gut and trying to be a strong leader.
Yeah, and I might jump to this question that we just got because it's germane to what we're discussing now. With the current agenda that we're seeing out of DC, do you think the evaluation of health-related social needs or social determinants is going to go away? And is that something you think you continue to do as an organization? What happens with how we evaluate the needs of our communities moving forward?
Yeah, I mean, we were literally just talking about this the other day. I think that while some of the resources and formal structures for doing some of this work may shift in the future, I think, and I'm hopeful that all of us in Massachusetts are really grounded in thinking about health in a broader way than we had a number of years ago. I know we are committed to continuing to do that work. In fact, we just recently launched, or in the process of launching, two of the locations for the AHEM project, which the state is the Advancing Health Equity in Massachusetts initiative, and we're going to be doing some work in Lowell and Lawrence and Brockton. And we were just talking about the fact that, like, while we're thinking about maternal health and while we're thinking about cardiometabolic disease, there's no way that we can do that work without thinking about things like nutrition and other issues in the social determinants space. And so I know we're going to remain committed to thinking about how we partner with groups and continue to keep that front and center. And I think it's going to be evolving for us as a state to figure out how we continue to do it, because I think there are very few people who I talk to in the healthcare space who don't recognize the importance and value of that work.
Yeah. Yeah, and I do love that anytime we're working on a project together, as things are evolving, you're always grounding it in the community voice and the patient voice. Say, we have to engage our community. We have to get out in the community and chat with them. And I always appreciate that. And you have a tremendous team. I mean, your staff is second to none. We enjoy working with them. And they're so focused on the needs of our patients and do such an incredible job. For the leaders joining us today, I mean, what's your advice on how to build a great team?
Yeah, I mean, for us, we always focus, when we're hiring someone, they have to really like have that drive for the mission of making sure that everyone in Massachusetts has the healthcare that they need. And so we're very focused on that. But in terms of, our thinking about our senior leadership, I often think about, I try to surround myself with people who both have substantive expertise and a team that has the way in which they do their work, their strengths in that way are complementary. So, for example, we have helpline directors, one of whom has been there for 18 years, who have the patience and the knowledge to be able to be supporting our team that's on the phone all day long. That's a level of knowledge and patience that like really boosts me as a leader and the organization. Our community engagement director knows, you can't walk into a community center without her knowing, half the room. And our policy team, while I'm able to be about like this deep on most topics, like they are way deep and way more knowledgeable than I am. And so I think for me, it's always been about surrounding yourself with people who are better, stronger, smarter in their areas and than you are. And I think that that's really important. I think the other piece then is recognizing people's strengths and how they do their work. So most recently, we just did a strength finders process with our executive team, and we have some really strong executors on our team. People who are like, "Give me a task, and I'm going to get this done." Then we have other people who are like, "Put me in a room with folks, and I'm going to be able to talk to them and figure out kind of where those partnerships are." And other folks who are like, "How do we strategically solve this problem?" And I think it's the combination of having all of those different types of people and strengths for people that for me is what builds success. And I think the other thing also is it's really about understanding people as individuals and what they need. And Rob used to always say to me, it's all of our responsibilities to train the next generation of healthcare leaders. And so especially with junior staff, I want to help them always figure out what skills they can be getting, how they can be growing in their job, not just for when they're at Healthcare for All, but when they go on and do other things. When staff leave Healthcare for All, we always kind of have a little hokey saying where we say, once a member of the Healthcare for All family, always a member of the Healthcare for All family. And we now have folks that are in state government and in hospitals and working all over the Commonwealth, and they all kind of have these connections back to Healthcare for All, and we'd like to think that we have done some part in helping them become leaders in some way.
Yeah, it sounds great. And certainly I know from your team and from your events, you like to have a little bit of fun too. So that's always great. You talked a little bit about what you're doing in the community and how you're continuing to focus on health equity. But kind of more broadly, any thoughts on efforts that the Commonwealth as a whole should be preparing for as we see eligibility and other changes coming?
Yeah, I have quite a few of those, but I'll try to keep it short for here. So, I think what's coming out of DC right now is really challenging. I think it's something that we have not seen before, and this is going to be a new set of challenges. If I had to be anywhere right now, I want to be here in Massachusetts because I know we have a commitment to coverage. We have a culture of coverage here that I think is really important. There are going to be some people who are going to lose health insurance, and there is going to be very little that we're going to be able to do to help those people other than our advocacy side and really thinking about what comes next for them. There's a whole other set of people who are going to potentially lose healthcare coverage because of changes in red tape and bureaucratic issues around enrollment. And for Healthcare for All, that's kind of our sweet spot. And that's where we are hoping to work with as many people as possible, including all the hospitals as well as other stakeholders, on running another large scale campaign to help people keep their coverage. So you mentioned the Mass Health Redetermination campaign. That was when the federal public health emergency ended. People have been protected on Mass Health for 3 years, and then all of a sudden they then needed to start reapplying, and people were kind of out of practice and didn't have their paperwork and didn't know how to reapply. And so in partnership with hospitals, insurers, health centers, all sorts of community groups, we had 50 community partners. We worked in 15 communities. We knocked on 500,000 doors. Our 50 community-based partners ran 2,700 events and talked to 1.2 million people. We ran ads in 65 local ad news outlets in 9 languages. And at the end of the day, the communities that we worked in on this campaign fared 4% better than keeping people covered than the rest of the state. And these communities where we worked were where half of the Mass Health members were living. So these were communities that had more challenges by and large, were more diverse in terms of their language and backgrounds. And in most other states, you saw communities that were comparable to these plummeting in terms of losing coverage. And in Massachusetts, those communities fared 4% better. And for that campaign, it ended up costing us $190 a head to keep somebody covered. So we are very committed to working with the state and stakeholders to trying to run a similar campaign, because as work reporting requirements come into place and twice a year mass health redeterminations and shortened open enrollment periods in the connector, when all of these types of things happen, people are going to need partners, and they're going to need education, and they're going to need local community voices helping them navigate this issue. And so Healthcare for All is in the early stages of trying to plan a campaign like this, and we hope everyone who's listening on this call would be eager to work on a campaign, because I think what happens is if a community resident gets a knock on their door from one of their neighbors and says, hey, now in order to keep your coverage, you're going to have to do these things. And then they go to their local health center or go to see their dermatologist and they say, hey, in order to keep your coverage, you're going to need to do these things. And then their insurance company is sending them the same information. The more people hear it in a consistent way, the more likely we are to keep people covered. And so I really look at this as a important opportunity, and Massachusetts is incredibly well prepared to do this, and Healthcare for All is really hoping to jump in and play this role with people.
Yeah, I mean, it was a pretty extraordinary effort on redetermination, and no pressure here, but we're betting on you again. And when we look at Georgia and the number of people that were never able to reconnect with coverage, we know that you will lead a different effort, and are frankly relying on that. Our Commonwealth is. So in a very tangible way, hospitals know that folks lose coverage. One of two things happen. It's a chilling effect on getting care, period. And then when we see folks that are sicker or they're coming to the ED. I mean, you talked about disseminating information. Is that the most tangible way? What are tangible ways that we can partner with you, or others that run advocacy organizations can partner with you to help when the time's right?
Well, I'll be very blunt. The first thing we have to do is actually raise the money to do this campaign. And so we're in those early stages. And then I think the second thing is, as we think about where the campaign will be run, I think it's about reaching out to local hospitals and then thinking about your networks also. And so I think the benefit too is that while the campaigns of this size really, I mean, we can't focus on every community across the Commonwealth. And so at some point there's some picking and choosing. However, what we've tried to always do is make materials available, social media available, talking points. We can send our staff out or some of our community partners when it's helpful. So I think that there's going to be endless opportunities to partner. I think the other thing that I would just also want to flag for people is that Healthcare for All runs something called In the Loop. And there's about 1,800 enrollment assisters across the Commonwealth. Many of them are located in hospitals as well as community groups, health centers, other places. In the Loop is a private online community for enrollment assisters. So you have to actually set up and be approved to be in the community. So it's a safe space for enrollment assisters to talk to each other. So they can actually go online and in real time say, hey, I'm sitting with a family right now. Mom's immigration status is this, dad's is this, kid's situation is this, having trouble enrolling them. Anyone have any suggestions? And we also take all the information from the state and relevant information from the feds and any kind of materials, and we put them all in one place for enrollment assisters so that they can stay current. And then as new information comes out, we have a newsletter that goes out to them. We do trainings. We work very closely with Mass Health and the Health Connector to make sure that there's information. And then from that information that we're seeing on the site, we pull out key themes, and then we're able to go back to the state and say, hey, enrollment assisters are really confused about this provision. There needs to be another training. We'll offer this in our community, but we also need the state to do X, Y, and Z. And we've been fortunate that we've had tremendous partnership with them. So for those of you who work with enrollment assisters in your hospitals, I'd urge you to just have them Google Healthcare for All and check out In the Loop. And if they have trouble, reach out to Steve or someone at MHA, and they'll know how to reach someone at Healthcare for All.
Amy, you're a gifted fundraiser, and I knew that for the first time in Executive Insights history, you'd turn this into a telethon. We'll have people calling in with pledges now to help. Quick 10-second response to a question we just got because we're running low on time.
Yep.
How are the elderly impacted? Anything specific there?
Yeah, I mean, I think that we definitely have to think about Many people who are enrolling in Medicare they have to go through the Social Security Administration with cuts there. We're seeing hold times that are extremely long. I'd urge people to reach out to Shine counselors, to enrollment assisters have gotten recently trained on how to help older adults. And we've worked with the state. The application used to be 38 pages. I think it's down to 7 now. But there are going to certainly be impacts for older adults, and I think we're going to have to continue to monitor that.
Great. You know, getting back to kind of our day-to-day challenges here, things we work on together, we've always been really proud to partner with you on like common sense legislation and improvements and evolution. One of the things we've been talking a lot about is prior authorization reforms.
Yep.
Can you just walk us through it in terms of a patient, how that affects patient, care in some cases?
So I asked our helpline to pull a recent call around prior auth, and this is the one that they gave me. So a helpline caller had just lost his coverage due to a divorce, and our staff worked with him to get enrolled, but he had to change providers because of a new plan network through the new insurer. He had an active prior auth for his blood pressure medication with the previous insurer, but in order to get the new medication approved, he had to have an appointment with his new doctor. That obviously took time. We helped him set up an appointment, but it took time. And in the midst of that, he was hospitalized for a cardiac event, right? So these are the types of calls that we hear all the time. And, for anyone who says that, it's just certain people that maybe have challenges not navigating prior auth, I will tell you that not so long ago, my husband, who's a developmental pediatrician, and myself, who runs Healthcare for All, our son needed to go through prior auth, and the two of us, it took us 6 weeks to get through prior auth for a case that was something we needed. So this is something we hear all the time. We're really proud that we're able to work with you all on trying to reform this, and we've got our head down. We're going to keep working on it.
Yeah. You might mention my son with a cleft lip and palate, 14 years of prior auth denials, remarkably troubling at times. All right, executive decisions, Amy. Here they are, 3 quick ones. What's your morning caffeine order?
Black iced tea.
Okay. Last great TV show that you watched?
The Pit, because I love Noah Wiley.
Yeah, and we're getting a lot of that. Get a lot of The Pit, a lot of Noah talk, and a lot of one of the first TV shows that really kind of takes time to get the details as close to right as possible on television. All right, you're sharing a meal. One notable person, dead or alive.
Yeah, well, I have to have a little dinner party. I'm a big sports fan, big women's sports fan. So Alona Mars, who's like amazing because she is all about like positive body image for young girls, and I love her. And Allie Raisman, because she not only was an amazing gymnast, but also really during the Larry Nassar sex abuse scandal, really became a true advocate. So I always have to like have my athletes kind of have this like advocacy side to them because I'm an advocate. So I'd have both of them for dinner.
That's pretty cool. You could round it out with Jaylen Brown, who's doing some great work in our community.
He's doing amazing work. We're trying to figure out how to get to him.
Yeah, I know. Yeah. Well, you already changed the rules all morning long. We might as well just keep going, right? It'll be
anyone have any ideas for us?
We're gonna need a reservation. Let's wrap up with our usual final question. Yep. What's one piece of advice you'd share with the emerging leaders that are with us this morning?
Yeah, I always just remind people when you're reflecting on your career to think about what are the skills I'm best at and like to use, what's the subject matter that I like to work on, and what's the setting that I like to be in. And I always talk to my graduate students about this, and I just think like it can help reground you as you're thinking about new opportunities in your career. And it's kind of my framework on helping people think about what they love about their job and what they want to continue to grow.
Amy, thanks. This wraps up our time together. Now, we do this all the time, right? We could do it with the camera on or the camera off because we enjoy our work together and each other, frankly. And so thanks for taking the time to be with us. Thanks, most importantly, for all you're doing for patients and communities when they need you the most. Our hospitals and health systems are proud to heal patients each day. But as I said at your event, you heal their souls, and it's pretty special. And to our attendees, thank you, as always, for joining us and for all you do to keep our world-class healthcare system moving forward, no matter what challenges come our way. If you enjoyed this morning's conversation, we have a busy season ahead just around the corner. You can check out all our educational opportunities at mhalink.org, including our Healthcare Safety and Violence Prevention Summit taking place in just a few short weeks. Thanks again for joining us this morning. Amy, thank you so much, and we hope you all have a great morning.
Thanks, Steve.